Hi everyone, this is Allison with Safety Education Specialists, and I'm doing this video today not for a skills demonstration like we normally do with our videos, but to critique a Today Show segment that came out. This is a Today Show segment with Megan Kelly, and she had an emergency room physician on the segment, and they were talking about what you can do as an untrained person if you see somebody have a heart attack. That was the first problem I have with the segment, and I am throughout this video going to throw up some screenshots to show you exactly what I'm talking about, and I will link to the video down below so you can take a look at it yourself. The first problem is the term heart attack. Heart attack is a medical emergency, not a cardiac emergency. There's a lot of differences between the two, but in general, you treat a heart attack with aspirin and calling 911 because the patient is still conscious. Once they become unconscious, now you're dealing with what's called a cardiac arrest. That's when you throw in your CPR and your AED, which is what the segment started with. Now, the physician did a couple of things wrong with this. I'm going to have my camera track down and follow me here, and I'm going to show you what happened. The physician placed his hands like so on the mannequin and did compressions like this. He wasn't going very deep. He was about a good half inch below where he should have been in terms of half an inch shorter in terms of depth, and his hands were wrong. They were facing this way. They're supposed to face like this. You should be at the patient's side with the heel of your hand along the sternum, so you have two lines here, okay? Not this way when you're perpendicular. The reason we do this is when our hand is like this, we're putting pressure across the entire front of the rib cage. That leads to a lot of extra damage. This mitigates the damage, and it lets you use your body weight a bit more effectively to push down nice and hard and fast between 2 and 2.4 inches. Verbally, he was saying the correct information, but he wasn't showing it. Now, the next thing, they had an AED trainer, and the AED trainer they used was the American Red Cross trainer. It's a generic trainer, not based on any real AED. So this is not a critique of the trainer. And I'm wondering if maybe the prop master set this up and didn't know how it worked. With the trainer as it was used in the segment, they have the pads pre-plugged in. With this trainer, if you do that, it jumps right into analyzing heart rhythm, don't touch the patient, because it thinks the pads are already in place. That was not really good for this demonstration. Also, they took the pads when they realized there was a problem with this and just threw them on the mannequin like so, not even placing them on the mannequin, and said, well, in reality, you would really do this. Again, we're talking about a visual demonstration to people. Take this couple of seconds and actually demonstrate what you're talking about. It doesn't take very long to do. Next, he moved into the Heimlich maneuver. And for this, he used a couple that were simulating sitting at a dinner and someone started choking and they were using a vest. We used the same type. And it has a large white button that you'll see in the screenshot that simulates the navel. When the young man put his arms around her waist, he didn't go just above the navel as you're supposed to. He went really high. Now you notice that's a lot of distance, a lot of difference. When you're this high, you can cause injury to somebody if you're doing it for real. So again, should go a bit lower on that one. Now I'll move over here, I'm going to show you about the epi. So the last segment was on the EpiPen, and this was a very rushed segment. I'll talk about that in a moment. But what he showed that was really dangerous is he took the EpiPen and pulled out the cap and then real quick said, you can inject it into your shoulder, no problem. Here, if you talk to the manufacturer, if you talk to a pharmacist, if you talk to the Heart Association or anyone else who's involved in first aid training will tell you the best way to use an EpiPen, grab a hold of the pen, pull out the blue cap, orange end goes into the thigh, and you press and hold there. The reason we choose the thigh over the arm is there's a lot more meat here. If you go here in the shoulder, you do have a chance, because the needle is about yay long, of hitting bone. And not only does it cause a lot of pain, but that also is ineffective in delivering the medication. Now, as an emergency room physician, the presenter, I'm pretty sure, is used to using not an auto injector, but a standard injection method, which means, yeah, you can put it in the shoulder, no problem. But with an auto injector, you have to be mindful the needle's very long. So we'll move back over here for some final comments. Assessment of that segment. Was it well-intentioned? Of course. Nobody wants to give information that might be harmful or really incorrect. However, The segment felt extremely rushed. They only had about 4 minutes to do it, and the presenter was Megyn Kelly. I've watched Megyn Kelly for many years on various networks with various interviewees and various segments. And what I've noticed with Megyn Kelly is she tends to talk over the people that she's interviewing or talking with very often. And she did that a lot with the doctor in this segment. So I do not wholly blame the doctor for this. Some of my colleagues on Facebook and social media were saying, that doctor's horrible. Who certified him? Take away his BLS card and things like that. But I really think that Megyn Kelly didn't give him a fair shake. If you're going to do a segment like that, let the person actually finish their sentence. Let them show the demonstration properly. And prop master, make sure you know how to use the AED trainer before you set it up. All right? Thanks a lot, everybody. Bye-bye.